Before the procedure starts, we must review the test request, identify the patient, and prepare them for testing. Afterwards, assemble equipment and supplies needed for the procedure. Wash your hands with soap and water for 15 seconds and/or sterilize with an antiseptic. Make sure to do this before and after every patient. Don your gloves and other necessary PPE for the procedure. Ensure that the gloves are a tight fit to easily locate the vein and for good manual dexterity. Apply and tie the tourniquet 3 to 4 inches from the intended puncture site. Use your index and middle fingers to palpate from one side to the other until you locate the vein. Find your landmark and release the tourniquet. Cleanse your patient in a circular motion from inside to outside to push away the dirt from the site of puncture. Inspect your tubes and syringe and make sure that they are still in date. To check the syringe, pull the plunger back and forth. Make sure that the needle is screwed in tightly. Reapply the tourniquet. Pick up and position the blood collection equipment. Remove the cover and inspect the needle to ensure that there are no barbs and shards. The bevel should be facing up, then anchor the vein. 1, 2, 3 stick the needle into the vein. When a flash of blood appears in the hub of the needle, pull the plunger slowly and allow the barrel to be filled with blood. Release the tourniquet. Place the cotton pad or gauze over, remove the needle, and apply pressure on the puncture side with the micropore or bandage. Transfer blood to the evacuated tube. Dispose of sharps, in this case, the needle. Label the specimen in front of the patient. Dispose of other used and contaminated materials, and finally, secure or transport the specimen to the lab. Before the procedure starts, We must review the test requests, identify the patient, and prepare them for testing. Next, we must assemble the equipment and supplies needed for the procedure. Next, sanitize hands and put on gloves. To start, position the patient. Select the puncture or incision site, preferably the middle or ring finger. Cleanse the site with alcohol and let it air dry. Puncture the site using the proper method. Wipe away the first blood drop because it may be contaminated with excess tissue fluid. Then, fill the microtainer with blood and mix by tapping the microtainer on the tabletop. Place cotton or gauze with bandage and apply pressure. Keep the puncture site elevated while inverting the tube 8 to 10 times. Label the specimen in front of the patient and observe special handling instructions. Then dispose of sharps, used and contaminated materials, and finally, secure or transport specimen to the lab. Don't forget to thank the patient after every procedure.